Amber, thanks again for answering some questions for me. I really appreciate your time. And I think I have a great understanding of what your overall program entails currently. Before I go into a solution, I wanted to go back to what we discussed over the phone, which was the 10 must-haves, what you should be looking for in an occupational health provider. And it started off a few years ago when Concentra started doing research with their existing business, their clients. And we had forums throughout the country focused on trying to understand what they're looking for in a provider. What we quickly learned is that there was no clear solution. There was no magic bullet list that we could go by and say, this is what we're going to use. We took those nuggets of information from our clients and then reached out to the American College of Occupational Medicine, as well as the American Medical Association and some other entities to gather research. And then we went internally. We have 30 years of medical expertise, and we pulled that information and compiled this tool that's right here that I'm going to give you. This tool is a list of the 10 must-haves that all employers should be looking for to compare their existing program. Based on our conversation today, there were several areas that you're missing. And I think that we were nodding through our conversation that were going to be kind of obvious. I'm going to go through some of these, and I'm going to leave this tool with you. Please keep in mind that this tool is not Concentra's list. This is an independent research of what you should be looking for, and Concentra is trying to apply certain pieces of this to our program. So regarding the 10 must-haves, the first thing that popped up to me was your current relationship with your provider. You're using an internal medical director that takes care of patients in-house. You do not have a physician that truly understands what your occupational health needs are based on what you said. Is that correct? Yes. The research states you need the ability to have a physician, an occupational health provider, that you can reach out to, that understands what your workflow is, what your restrictions are, understands what the risk factors are within the facility, and have the ability to partner with you and help you on the management of those cases. And I think that's an area that was apparent that you're missing, thus leading to some of the other concerns that you have. Along with that physician relationship, that provider should also be able to articulate the importance of coming back to work when they are seen by them at a medical practice. And then employers like yourself should be able to tie in your established injury care process. What is the process from beginning to end for your injury, and how does your provider fit into that? And I think you mentioned a couple of times that you have to find this provider. He's not there every day, so the individual goes to the emergency room, and then 3 days later they see this doctor that's at your facility, correct? And this is where you start losing some of that ability to manage the case. As you go down the must-haves, we look for employers that have a focus on health and wellness. We were talking about leaving a facility, and I think that's one of your biggest challenges, your biggest risks right now is physically leaving the building to get care. And we acknowledge that a lot of them are leaving already because they have to go to an emergency room with their own provider when the provider's not here. When they are leaving a facility, the research states you should have a couple of things. One is a welcoming environment, a facility that's comfortable, clean, and someone wants to go there. And then two is a facility that has everything in it, and has most of the services that you need, ranging from X-ray, physical therapy, or sometimes specialist care. As you go through the survey piece, one of the parts that I think you get fairly well is your communication from the provider when he is here. But you mentioned your lost time is happening when they leave your facility. The provider you partner with should be able to articulate communication at a time when they leave, as well as ongoing with the care. So you need the ability to have some form of automated communication. It could be a fax, it could be an email, as well as the ability to get a hold of this provider or this system, so you can communicate what you're seeing and or bring up any red flags or anything like that. Does that make sense? Excellent. And then when you want to finish off is the provider you're using, as we discussed in our conversation, does not have an occupational health focus. He has a focus on the population he works with, which is the elderly population that's there. So the provider that you partner with, you want to understand what their philosophy is. Do they have an early intervention medical model, a medical model that's aggressive to help get your LNAs back to work. And you should understand what that is. You should also have a report card system. At the end of a quarter, at the end of a month, at the end of a year, you should be able to sit down with your provider, your partner, and be able to sit down and look at how do we do year over year? Did we help reduce the cost, or in this case, your lost time cases, year over year, and why? How do we do it? If not, then what happened? So we took this research, and again, this is for you here. You go. And what Concentra started doing was looking at this and saying, okay, where do we stand? We have 300 plus centers, and we wanted to evaluate how our centers were doing. And what we learned was that we were all over the place in certain directions. We weren't following these 10 must-haves. We decided to break out these 10 must-haves into 4 keys, and the keys are there's a sheet right there for you. Keys are employer engagement, which is how you and I work together, Mr. Employer and Mr. Provider. Patient engagement, which is the experience that your employee, in this case your LNA for the most part, experiences when they go to a medical practice. Third is clear communications. What is the communication expectation that your provider has put in place? And then lastly is the quality medical outcomes, which is the actual medical care itself. For the purposes of today, I'd like to just focus on employer engagement and clear communications. Because during our conversation, those were the 2 things that kept popping up as the most important for our conversation today. So, employer engagement. What we believe in employer engagement is to establish a provider that understands, or assistant understands your system. So we start off with creating a profile for you, a customized profile for you that has your instructions based on what we need to do for you. So, for example, if there's a physical involved, that physical result goes to the appropriate department. If there's a contact that needs to be put in place or some instructions that needs to be put in place for a specific department, we can go ahead and do that. You know, you mentioned a couple times about Joanne from your nursing department not getting the same information as you do. As the engagement part gets established, as the program gets created, we can pinpoint who's going to get what pieces of information. Does that sound beneficial to you? Excellent. Now there's the provider piece. In order for us to do a good job for you and to help you reduce your lost time, which is the focus of what you're trying to do for this year, our providers and our therapists need to understand what you're doing. So we'd like to bring our provider out for a tour, understand where your injuries happen, point out the areas that you've used for modified duty. I'd like to bring our therapist out as well because the vast majority of your injury, I guess 40%, are musculoskeletal. And I'd like to bring our therapist out to do the same thing. You know, and during that time, we can point out and understand what the environment is here. We work with hundreds of nursing homes throughout the country, but each one's a little bit different. Yes, we all have the same goals, and there's a lot of challenges, especially now with Medicare being tighter. Everyone has a lot of similar challenges, but it's important for our provider to understand your facility and what challenges you face in particular here. Along with patient engagement, I mentioned the clear communication piece. The communication, we have twofold, is the way I like to look at it. The first phase is at the front end. So at the front end of communication, when someone walks into our facility and gets checked out, there is an electronic communication sent out back to the appropriate parties, as I mentioned earlier, specific to how we set it up. That is the trigger to you of that we saw the employee and these are the next steps. It's giving you the access immediately to that individual so you can start taking care of that care. Out of your, I think it was 15 injuries, out of your lost time cases, the majority of them came when they went to the emergency room or their own provider. And you did not know about that injury until 2 to 3 days later. In our system, if someone gets hurt and they walk into our door, we have to call an office. Say if they walked in and we didn't know who they were, we're going to call and verify that. But regardless, when they leave our facility, if this is set up correctly, you're going to get an email as the administrator knowing that this person came in, and you can jump on them. And the odds are they're not taken out of work, but even if they are, you now know and you can address it immediately. That's going to save you days from what you have right now. And then along with that is a phone call. Our providers will call on an initial visit, more to give you a heads up on how the care is going, and then call on red flags. And we do this to establish the communication between you and us. and therefore you can share information of what's going on if there's anything, any red flags of your own, like this person's been a difficult employee, or they're going through a tough time right now, etc. Okay, so those are the two components that we have, the two keys that I wanted to discuss today. In your opinion, does this sound like what you're really looking for to help solve your lost time issues that you have now? Excellent. So what I'd like to do is this. We have two other keys. The employer engagement, which is what happens with the employee when they come in, and then quality medical outcomes. I'd like to set up a time next week for you to come in with the administrator, with your nurse, to have a tour of our facility, meet the provider, go over the medicine itself, as well as see the facility itself, and I'll show you how that patient engagement kind of fits into the mix. Does that sound good? Excellent. How about next Tuesday? Excellent. I thank you again for your time. I really appreciate it. I look forward to next Tuesday. And I'll leave this with you here. And you have a nice day. Thank you.